Hello and welcome to Workers Comp Unwrapped, the podcast that simplifies workers' compensation for physicians. I'm your host, Max, here to give you clear, actionable insights to navigate the medical legal side of workers' comp. Welcome back to Workers Comp Unwrapped.
Let's get
Season
started.
2, Episode 14 with Max. Max, meet Aisha. She has like 15 years of experience in the workers' comp industry. And
Hello.
today we're diving into strategies for managing cases that involve care from multiple specialists, ensuring seamless coordination and billing accuracy.
Huge.
I know it's a mouthful.
Yes.
But it's a topic that can really make or break your practice.
Yeah, absolutely. And, these multi-provider cases, they're becoming more and more common as we see, more complex injuries and treatment approaches. The good news is, with the right strategies, you can really ensure better outcomes for patients and your bottom line as well.
For sure. Let's imagine, a worker with a severe back injury, right?
Okay.
You might have an orthopedic surgeon, a physical therapist, a chiropractor, maybe even a pain management specialist, all involved.
Right.
That's a lot to juggle.
That's a lot of people.
And for our listeners out there, I'm sure many of you are nodding your heads right now.
Yeah.
Because you're dealing with these complex cases every day.
Every single day. Yeah. You hit the nail on the head. Without coordination, these cases can become a logistical and financial nightmare. We're talking conflicting treatments, redundant care, delayed recovery for the worker, and a whole mess of billing issues.
So let's break it down. Why are these cases so inherently complex?
Yeah.
More experts should mean better care. Right?
Yeah. Well, in theory, yes.
Right.
But the reality is that adding more specialists to the mix kind of introduces this whole new layer of challenges. For starters, each specialist has their own perspective,
Right.
their own treatment protocols and their own way of documenting things.
Makes sense. I imagine the severity of the injuries we're talking about adds another layer of complexity on top of that.
Exactly. We're often dealing with cases that involve spinal cord injuries, catastrophic accidents, or chronic conditions that require ongoing care. These aren't simple sprains or strains. These demand a multifaceted approach, which, if not carefully coordinated, can quickly spiral into a tangle of conflicting advice and redundant treatments.
So you've got this team of experts, complex injuries, and the potential for things to get, messy. What does that look like in practice? What kind of challenges should our listeners be prepared for?
One of the most common pitfalls is communication breakdowns.
Oh, yeah.
Between providers. When doctors aren't talking to each other, sharing information, or coordinating their treatment plans, the consequences can be significant.
It's like that game of telephone we played as kids. The message gets completely distorted by the time it reaches the end of the line.
That's a great analogy, except in this case, the stakes are much higher than a silly message. We're talking about a worker's health and their ability to return to work. Imagine a scenario where the surgeon clears the worker for light duty, but the physical therapist isn't aware and keeps them on a more restrictive program. That's lost time, potential delays in recovery, and a lot of frustration for everyone involved.
Right, and then of course there's the documentation piece. I'm guessing fragmented records can really throw a wrench in the works.
Absolutely. When you have multiple providers, each with their own set of notes, reports, test results, it can be a nightmare trying to piece together a clear picture of the overall treatment plan and progress.
From the insurer's perspective, it might look like a bunch of random treatments rather than a coordinated approach, right?
Exactly. And if the insurer can't see the rationale behind the care, they're more likely to deny claims or delay reimbursements, which, let's be honest, no provider wants to deal with. It's a headache for you, and it delays your patients' access to the care they need.
Which brings us to, the billing and coding side of things.
Ooh.
Just thinking about, all the potential for errors is giving me
I know.
anxiety.
Yes. It's definitely an area where things can go wrong quickly. Duplicate billing, incorrect codes, modifiers that aren't properly applied, all of these can lead to denials, payment delays, and a lot of back and forth with the insurer. And this is where I see providers leaving money on the table, They're providing excellent care, but they're not getting paid for it because of billing errors.
It sounds like a lose-lose situation.
Totally.
The provider loses revenue, and the worker's recovery is potentially jeopardized. But before we dive into solutions, I want to highlight another challenge. authorization delays.
Oh, authorization delays. Yes.
I know from personal experience how frustrating it can be to just sit and wait for approvals.
It's a huge pain point, and in complex cases where you might need multiple authorizations for different treatments, the process can become incredibly time-consuming and frustrating. I've seen cases where the authorization process takes longer than the actual treatment itself.
And it sounds like we've got a perfect storm brewing here, right? Miscommunication, documentation nightmares, billing errors, authorization delays. It's enough to make anyone want to throw in the towel.
Yeah.
But before we do that, let's shift gears and explore some proven strategies for navigating these complexities. I'm eager to hear what Aisha has to say about this.
I'm happy to share what's works for me and for many other providers, and I promise it's not as daunting as it might seem. With a little bit of planning and a focus on collaboration, you can turn these challenges into opportunities to deliver better care and maximize your revenue.
Okay, Aisha, let's talk solutions. I know our listeners are eager to hear how they can tame this multi-provider beast and come out on top.
You got it. The first and arguably most crucial step is establishing a lead provider or a case manager. Think of this person as like the captain of the ship, steering the entire treatment plan and making sure everyone is rowing in the same direction.
So instead of 5 different specialists sending, separate reports, RFAs, you've got one central point person streamlining everything. I like it.
Exactly. This lead provider, often the primary care physician or the specialist most heavily involved in the case, they become the hub for communication. They make sure everyone is on the same page, working towards the same goals, and that the treatment plan is cohesive.
Makes total sense. It's like having a dedicated project manager for the worker's recovery. But what about the treatment plan itself? A unified plan. That sounds like more than just a list of appointments.
You're right. A truly unified treatment plan is like a roadmap that guides the worker's recovery journey. It clearly outlines the roles and responsibilities of each provider, sets specific timelines and milestones, and most importantly, ensures everyone understands the overall treatment strategy.
So it's not just a relay race where each specialist, hands off the baton and says, okay, your turn.
Right.
It's a much more integrated approach with everyone working together toward a common goal.
Precisely. And remember, this plan should be a living document, adaptable and responsive to the worker's progress. Regular check-ins and adjustments are key to keeping everyone aligned and maximizing the chances of a successful recovery.
Okay, so we've got a lead provider coordinating things, a unified treatment plan in place. What's the next critical step?
Next up is tackling that communication monster. We need to move beyond casual phone calls or emails and implement systems that promote seamless information sharing.
Give us the goods, Aisha. Like, what kind of systems are we talking about?
2 words: shared EHRs.
Shared EHRs.
When everyone has access to the same up-to-date medical records, it dramatically reduces the risk of conflicting treatments, missed information, redundant tests. It's like a game changer.
I'm with you on that. Shared EHRs sound like a no-brainer, but what about those dreaded RFAs? How can we avoid getting stuck in authorization limbo?
That's where our lead provider steps back into the spotlight. They become the point person for submitting RFAs, gathering all the necessary information from each specialist, and ensuring the requests are comprehensive and well supported.
So it's not just a quick email saying, hey, this patient needs physical therapy. It's a detailed and well-documented case that clearly justifies the necessity of the treatment.
Exactly. And including supporting documentation from all providers is crucial. The more evidence you can provide to demonstrate the medical necessity of the treatment, the stronger your case will be and the smoother the approval process is likely to be.
And proactive follow-up is key, right? We shouldn't just sit back and twiddle our thumbs while we wait for the insurer to make a decision.
Absolutely not. The lead provider should be actively following up with the insurer, answering any questions they might have, and keeping the process moving forward.
So it's about being assertive, but not aggressive.
Right.
We want to build a collaborative relationship with the insured, not an adversarial one.
That's a great way to put it. Now, even with a lead provider and excellent communication, there's another potential pitfall we need to address: documentation.
Yeah.
Even if everyone's on the same page, if the documentation is sloppy or inconsistent, it can create major headaches down the road.
Oh, I know that feeling. I remember a case where, let's just say it wasn't pretty. So how do we ensure top-notch documentation in these complex cases?
It starts with consistency. All providers should be using standardized documentation templates to ensure clarity and uniformity across the board. And the focus should be on outcome-based records. We need to clearly show how the treatments are directly impacting the worker's recovery and their ability to return to work.
So instead of just documenting what was done, we're highlighting the progress being made, the functional improvements the worker is experiencing, and how the treatments are directly contributing to their ability to get back on their feet.
Exactly. This not only helps justify the need for care to the insurer, but it also demonstrates the value of the services you're providing. And when you can clearly show the value you're bringing to the table, you're in a much stronger position to negotiate, fair reimbursement rates.
This is all gold, Asha. It sounds like we're building a solid foundation for success. But there's one piece we haven't mentioned yet: billing and coding. How can providers avoid those costly errors that can lead to denials and delays in payment?
This is where investing in staff training pays off big time. Your billing staff needs to be well-versed in workers' comp-specific codes and modifiers, especially those related to multiple procedures or overlapping treatments. Regular audits of billing practices can also catch errors before they snowball into major problems.
So it's not just about getting the codes right, it's about understanding the nuances of workers' comp billing and how it differs from regular medical billing.
Exactly, and another key strategy is using clear and unique identifiers for each treatment to avoid duplicate billing. If the surgeon and the chiropractor both bill for treatment of back pain on the same day, it's going to raise red flags with the insurer.
Right, specificity is key. We need to paint a clear picture of exactly what services were provided and why they were necessary. But Aisha, before we move on, I want to circle back to something you mentioned earlier about maximizing revenue.
Right.
Can you elaborate on that a bit?
Of course. When we talk about maximizing revenue in these complex cases, we're not just talking about avoiding billing errors. We're also talking about strategically positioning yourself to negotiate favorable reimbursement rates with insurers.
Interesting. So how do we do that? How do you increase our leverage in those negotiations?
It all comes down to demonstrating the value you bring to the table. When you can clearly show the insurer how your expertise and coordinated care approach are leading to better outcomes for workers, faster recovery times, lower overall treatment costs, reduced disability durations, you're in a much stronger position to command higher reimbursement rates.
It sounds like we need to become masters of showcasing our value, not just to our patients, but to the insurers as well.
Exactly. And that's where data comes in. Tracking your outcomes, gathering patient testimonials, and building a strong case for the effectiveness of your multidisciplinary approach is essential.
Data is king. It's not just about providing care. It's about proving that your care is making a real difference. Okay, so we've covered lead providers, unified plans, communication strategies, documentation best practices, billing tips, and even negotiation tactics. But there's one piece we haven't mentioned yet: the insurer. How should providers approach working with adjusters and case managers in these complex cases?
That's a crucial element. Remember, adjusters and case managers aren't the enemy. They're part of the team, and collaboration is key.
So instead of seeing them as gatekeepers or roadblocks, we should view them as partners in the worker's recovery. I like that shift in perspective.
Exactly. Regular communication, sharing updates on the worker's progress, involving adjusters in case review discussions, all of these can help build a positive and collaborative relationship.
It sounds like transparency, proactiveness, and responsiveness are key to building that trust and rapport.
Absolutely. And remember, the adjuster has a wealth of knowledge about the workers' comp system and can often provide valuable insights and guidance.
Okay, this is all starting to come together, but I think our listeners might be wondering how these strategies play out in, a real-world scenario. Do you have a case study that can bring it all together?
I do. Let's go back to that worker with the severe back injury who is seeing multiple specialists. Initially, this case was a complete mess. Different providers were submitting redundant RFAs. There were conflicting treatment recommendations, and approvals were getting delayed left and right. It was classic chaos.
Sounds familiar. So how did they turn things around?
They did exactly what we've been talking about. They designated the orthopedic surgeon as the lead provider, developed a unified treatment plan that clearly outlined everyone's roles and responsibilities, started using a shared EHR system for seamless communication, and ensured all RFAs were comprehensive and well-documented.
So they went from a free-for-all to a well-coordinated team effort. What was the outcome?
The results were remarkable. RFAs were approved quickly, the workers' recovery progressed much more smoothly, and they were able to return to modified duty within the expected time frame. And on the billing side, there were no disputes or denials. Everyone got paid on time.
That's a fantastic example of how getting these things right can make a world of difference, not just for the providers, but for the worker as well. But before we wrap up, I want to hear your final thoughts on what our listeners should take away from all of this.
My key takeaway is this. Managing complex workers' comp cases with multiple providers is challenging, but it is absolutely possible to achieve positive outcomes for everyone involved. The key is to approach these cases strategically, prioritize collaboration and communication, and always keep the workers' well-being at the center of every decision.
So it's not about throwing up our hands in frustration. It's about taking charge, implementing these proven strategies, and turning a potential nightmare into a success story. And before we let our listeners go, I want to leave them with something to ponder. What do you think is the biggest barrier to effective collaboration in these cases? What's the one thing that keeps tripping providers up?
That's a great question, and I think the answer is simple: lack of trust. When providers view each other as competitors, or when they don't trust the insurer's motives, it creates an adversarial environment that makes collaboration nearly impossible.
That makes a lot of sense. So the first step towards success is building trust and recognizing that everyone is ultimately working towards the same goal, the worker's recovery.
Exactly. When we shift our mindset from competition to collaboration, we unlock a whole new level of efficiency and effectiveness.
I love that. Collaboration over competition. That's a message we can all get behind. Well, that's all the time we have for today. Thank you so much for joining us for this deep dive into the world of complex workers' comp cases. We hope you found it insightful and helpful. And for our listeners who are ready to put these strategies into action, we've got some bonus content coming up on our website. We'll be sharing a downloadable checklist of those key strategies, along with some real-world examples and resources to help you implement them in your practice.
We'll also be hosting a live Q&A session next week where you can get your specific questions answered by yours truly and other experts in the field. Be sure to check out the show notes for all the details.
And don't forget to subscribe to Workers Comp Unwrapped so you don't miss future episodes. We've got some amazing topics lined up for Season 2, all designed to help you navigate the ever-changing world of workers' compensation.
Until next time, keep those collaborative spirits high, and remember, together we can make a difference in the lives of injured workers and build thriving practices.
That's a wrap for today's episode. Thanks for tuning in. And for our listeners who are ready to put these strategies into action, we've got some bonus content coming up on our website. We'll be sharing a downloadable checklist of those key strategies, along with some real-world examples and resources to help you implement them in your practice.
We'll also be hosting a live Q&A session next week where you can get your specific questions answered by, well, me and other experts in the field. Be sure to check out the show notes for all the details.
And don't forget to subscribe to Workers Comp Unwrapped so you don't miss future episodes. We've got some amazing topics lined up for Season 2, all designed to help you navigate the ever-changing world of workers' compensation.
Until next time, keep those collaborative spirits high. And remember, together we can make a difference in the lives of injured workers and build thriving practices.
That's a wrap for today's episode. Thanks for tuning in. Thank you for listening to Workers Comp Unwrapped. If you found value in today's episode, share it with your fellow medical providers and healthcare specialists. For more information, contact us at lena.klein@medicallienmgt.com or visit our website, medicallienmgt.com.